Welcome to the deep dive. We take complex topics, grab a stack of sources, and really try to unpack the most important insights for you.
Yeah, really getting into the weeds.
Exactly.
Mhm.
Today, we're plunging into something I think a lot of us pet owners have unfortunately dealt with: chronic vomiting.
Hmm.
Seems simple, right? Pet throws up a few times, you think, okay, maybe ate something weird. But as we're going to find out, it's actually surprisingly complex.
It really is. It can point to potential issues, all over the body, not just the stomach.
Right. So when it keeps happening, or it's been going on for weeks, maybe months,
Hmm.
you quickly realize it's probably not just going to fix itself.
No, definitely not. And the sources we're looking at today, these are excerpts from vet study guides, clinical texts, specifically on chronic vomiting. They make it really clear. This is like a medical puzzle that needs careful work.
Okay, so our mission today is to cut through all that info vets have to sift through. Understand what chronic vomiting really means, why the list of possible causes is just
It's
enormous,
huge.
how vets actually approach figuring it out, that whole detective work process, and then, critically, what can actually be done about it.
So yeah, whether you've personally gone through this with your dog or cat, or maybe you're just interested in how vets tackle these kinds of challenges,
Yeah.
stick with us.
This deep dive should give you a much clearer picture. Let's start right at the beginning, though. What actually makes vomiting chronic versus just, a one-off thing?
Good question. It's about persistence. The sources generally define it as vomiting that lasts longer than, say, 3 to 7 days.
Mm.
Or maybe it happens frequently, like multiple times a week, over a longer stretch of time.
Okay, so it's the pattern.
It's the pattern. And the key thing is, unlike acute vomiting, which can sometimes be mild, maybe self-limiting chronic vomiting almost always signals some kind of underlying medical issue that really needs looking into.
Ah,
It's very rarely something that just gets better with, like, basic symptomatic treatment.
so it's a big red flag saying dig deeper.
Precisely. And then there's another layer of complication right away, making
Yeah.
sure it's actually vomiting and not regurgitation.
Right. From the owner's perspective, it just looks like stuff coming up, right?
Exactly. But physiologically, they're totally different.
Mm.
And they point to completely different problems.
So how do we tell them apart? What's the difference?
Okay, so regurgitation, that's passive. Usually undigested food, maybe just fluid, basically just sliding back up from the esophagus. There's no abdominal effort, no heaving.
Like it just falls out.
Pretty much. Causes are usually related to the esophagus itself. Maybe it's dilated, maybe there's a blockage there. Vomiting, though, that's an active, forceful reflex.
Okay.
You often see warning signs. First, the pet might look nauseous,
Yeah.
lip licking, drooling a lot, maybe restless, swallowing repeatedly.
Okay.
Then comes that unmistakable abdominal push, the heaving, the contractions needed to actually eject stuff from the stomach, sometimes even the upper small intestine.
That forceful heave is the giveaway for vomiting.
That's the main thing to look for. But just to make it interesting,
Oh, boy.
sometimes chronic vomiting itself can irritate the esophagus secondarily. So a pet might start regurgitating as well as vomiting, which can definitely muddy the waters initially.
Okay, confusing. And the mechanism itself, it's controlled by the brain.
Yeah, the vomiting center is called, deep in the brainstem, the medulla. And what's really interesting is how many different places send signals to that center.
Like what?
Well, signals can come directly from the GI tract if it's irritated or stretched. They can come from another brain area called the CRTZ, the chemoreceptor trigger zone. Think of it like the body's toxin sensor, reacting to things in the blood.
Ah, okay.
Signals also come from the inner ear, the balance system that's your motion sickness trigger. And even from higher brain centers, which means things like stress or fear can, in some cases, contribute.
Wow. So because all those different systems feed into it,
Mm-hmm.
that's why the list of causes is so massive.
That's a huge part of it. Which leads us right into that landscape of causes. The sources basically split them into two big categories. Problems starting in the GI tract itself, primary GI causes, and problems elsewhere in the body that affect the GI tract, we call those extraintestinal or systemic causes.
Okay, GI versus systemic. And vets have to consider both.
Always. It's why the differential list, the list of possibilities, is just so broad for chronic vomiting.
Let's tackle some of those key GI causes first. Inflammatory bowel disease, IBD. That sounds pretty common according to the
Wow, it's
slide.
very common. Yeah, it's basically chronic inflammation somewhere along the digestive tract, stomach, small intestine, colon, could be anywhere. A lot of the time we don't find a single specific trigger, so we call it idiopathic.
Meaning cause unknown.
Right. But it seems to involve this complex interplay between the pet's own immune system, the bacteria living in their gut, and probably dietary factors too.
And the sources mention some breeds are more prone. Basenjis, German Shepherds.
Yeah, Basenjis, Shepherds, Shar-Peis seem to get IBD more often. Generally, Rottweilers are mentioned specifically for a type with lots of eosinophils, a certain white blood cell. So breed can be a clue.
Hmm.
But ultimately, getting a firm diagnosis of IBD often involves getting biopsies, actually looking at the tissue under a microscope.
Okay. And diet comes up again with adverse food reactions, not just being picky, but a real physical reaction.
Exactly. It could be a true food allergy, which is an immune response usually to a protein, or it could be a food intolerance, which is more of a digestive issue, not immune-mediated.
And the key way to figure that out is the food trial.
The dietary elimination trial, yeah, this is crucial. You switch the pet to a very specific diet,
Mm.
either one with a novel protein, something they've absolutely never encountered before, like venison or duck or rabbit,
Okay.
or a hydrolyzed diet, where the proteins are broken down into such tiny pieces the immune system hopefully doesn't recognize them.
And it has to be super strict.
Incredibly strict. Absolutely nothing else by mouth. No regular treats, no table scraps, no flavored meds, nothing. For usually like 6 to 12 weeks.
Wow.
If the vomiting stops on that diet, and ideally comes back if you reintroduce the old food, that's really strong evidence for a food-responsive issue.
That takes serious commitment from the owner.
It really does.
What about pancreatitis? I usually think of that as like a sudden, really bad, painful
I mean,
thing.
acute pancreatitis, yeah, that can be dramatic.
Yeah.
But what the sources emphasize is that chronic pancreatitis, kind of a persistent, low-grade or recurring inflammation of the pancreas, is being recognized more and more as a cause of chronic vomiting. Especially in cats, it can be quite subtle sometimes.
Huh. Intermittent vomiting, maybe off their food a bit.
Exactly. Discomfort, poor appetite. There are specific blood tests, the CPLI for dogs, FPLI for cats, that are much better for diagnosing pancreatitis than the general enzymes on a chemistry panel.
Okay. And then the tough one, cancer in the gut.
Unfortunately, yes. Gastrointestinal neoplasia, things like lymphoma, very common cancer in cats, or adenocarcinoma, other types of tumors, they can cause vomiting by physically blocking things, causing inflammation, ulceration, sometimes even by producing hormones or substances that affect the gut.
A partial blockage sounds like it would cause chronic issues too, not just sudden ones.
Definitely. If something is only partially blocking the way, food might still get through, but slowly, with difficulty. So you see chronic vomiting maybe happening hours after a meal.
What kind of things cause that?
Could be a foreign object that's stuck but not totally plugging things up. Could be pyloric stenosis, that's a narrowing where the stomach empties into the intestine. Could be congenital or develop later. Some breeds, like bulldogs, boxers, are prone to a type where the stomach muscle gets too thick there.
Ah.
Or strictures, like scar tissue narrowing the passage, or even masses pressing from the outside.
Gastric ulcers. Seems obvious they cause vomiting.
Yeah, sores in the stomach lining can definitely cause chronic vomiting, maybe with some blood. Sometimes it's from long-term use of certain drugs like NSAIDs. Other times it's secondary to other diseases like kidney failure or certain tumors like gastrinomas or mast cell tumors that cause way too much stomach acid.
Chronic gastritis, just like ongoing stomach inflammation.
Persistent inflammation. Could be linked to, the dog that eats everything it finds in the yard. Chronic dietary indiscretion. Or it might be part of that IBD picture we talked about. Some sources mention Helicobacter bacteria, but its role is still a bit debated sometimes.
And sometimes the problem is just that the gut isn't moving properly, like it's sluggish.
Exactly. Motility disorders, delayed gastric emptying, or gastroparesis is a big one. Food just sits in the stomach too long. Could be idiopathic, no known cause, or secondary to other things like electrolyte problems, like low potassium or diabetes, or just severe inflammation slowing things down.
Parasites. Usually think acute diarrhea, but chronic vomiting too.
Absolutely. Some parasites are definitely known for causing chronic intermittent vomiting. Giardia can do it. There are specific stomach worms, like Physioptera in dogs, Olalanus in cats. You need the right tests and the right dewormers to target them.
Okay. And bilious vomiting syndrome, that sounds specific.
It is. Typically, the pet vomits yellow bile, often in the early morning on an empty stomach. The theory is bile refluxes from the intestine back into the empty stomach and irritates it.
What helps that?
Often, just feeding a small snack right before bed can make a big difference. Just keeps the stomach from being totally empty overnight. There are other less common things too, like fungal infections, bacterial overgrowth. The list goes on.
Wow, okay. And that's just the stuff happening inside the GI tract.
Right.
Now we have the whole other category of problems elsewhere in the body causing the vomiting. Chronic kidney disease, you mentioned that's a big one, especially in older pets.
Huge. Very, very common. As the kidneys fail, waste products, uremic toxins, build up in the blood. These toxins are nasty, they directly irritate the stomach lining, and they stimulate that CRTZ trigger zone in the brain we talked about. So vomiting is a really classic sign of CKD.
Liver disease works similarly.
Pretty similar idea, yeah. Chronic liver failure, inflammation like cholangiohepatitis, they mess with metabolism, toxins build up, cause nausea and vomiting. Some breeds get chronic liver issues more often, like Cocker Spaniels, Bedlington Terriers.
Hyperthyroidism in cats seems like almost every older cat gets checked for this.
It's incredibly common, yeah. Overactive thyroid floods them with hormones, speeds everything up. They lose weight despite eating a ton.
Right.
And that increased metabolism and gut speed often leads to vomiting, sometimes diarrhea too.
Okay, now Addison's disease. The sources call it the great imitator. Why is it so tricky?
Hypoadrenocorticism, yeah. It's tricky because the signs are often really vague. They can wax and wane, get better, get worse. Chronic vomiting, maybe just lethargic, poor appetite.
Sounds like a lot of things.
Exactly. It mimics so many other problems. And because the signs can be intermittent, it's easy to miss or misdiagnose initially. It's a failure of the adrenal glands. Sometimes you see classic electrolyte changes, high potassium, low sodium, but not always. You absolutely need a specific test, an ACTH stim test, to diagnose it.
Even diabetes, can that cause chronic vomiting?
Especially if it's not well controlled.
Yeah.
Big swings in blood sugar or complications like ketoacidosis can definitely cause ongoing nausea and vomiting.
High calcium levels, too.
Hypercalcemia, can be caused by certain cancers or parathyroid gland problems. High calcium itself messes with gut function and can trigger vomiting.
What about long-term medications or toxins?
Sure. Chronic use of some drugs, we mentioned NSAIDs, maybe steroids sometimes, or potentially low-level ongoing exposure to something toxic in the environment.
And less commonly neurological issues.
Less common for chronic vomiting compared to all these other things, but yeah. Persistent problems with the balance system, or maybe certain types of brain lesions, could potentially cause chronic nausea.
Okay. My head is spinning. That list is just immense. Ranging from, eating weird stuff to kidney failure to hormone imbalances to cancer. How on earth does a vet even start to unravel this? It really sounds like detective work.
It absolutely is. And because that list is so vast, you cannot just guess. You have to be systematic, step by step, using the clues you gather along the way to narrow down the possibilities.
And step one, the absolute foundation, is talking to the owner, right? Getting that history.
Crucial, paramount. Getting all the details from you, the owner. How long? How often? What does the vomit actually look like? Food, bile, foam, blood, foreign objects. When does it happen relative to eating? Right after, hours later. Any other signs? Weight loss is a huge one. Appetite changes. Diarrhea. Drinking more. Peeing more. Energy levels. What exactly are they eating? Food, treats, table food, things they chew on, access to garbage or outdoors. Everything. Medications, supplements, travel history, any previous issues. For cats, specifically asking about hairballs is important too. These details are gold. They guide the whole workup.
Okay, history first, then the hands-on physical exam.
A really thorough one. Check their body condition score. Are they thin? Check hydration. Carefully feel the abdomen. Any pain? Can you feel thickened bowel loops, which might suggest IBD or cancer? Any masses? Are organs like kidneys or liver enlarged? Check lymph nodes. Look in the mouth. Dental disease. String under the tongue in a cat. Signs of uremia. Rectal exam is important too, looking for blood, masses. And in older cats, definitely palpating the neck for thyroid nodules.
Okay, history and exam give you the initial direction, then you move to the first round of tests, the minimum database.
Right. These are standard screening tests. Complete blood count, CBC. Looks at red cells, white cells, platelets. Can show anemia, maybe from chronic bleeding or kidney disease. Changes in white cells hint at inflammation, infection, stress. And importantly, like we mentioned, high eosinophils can point towards parasites, IBD, sometimes Addison's. Low platelets can sometimes be seen with IBD too.
And the chemistry panel checks organ function.
Exactly. Serum biochemistry. Checks kidney values, BUN, creatinine, SDMA. Checks electrolytes, sodium, potassium, chloride. Certain patterns here are really suggestive, like low sodium, high potassium for Addison's, or low chloroglutamate potassium with high bicarb can suggest an obstruction high up, near the stomach exit. Looks at liver enzymes, glucose for diabetes, protein levels, especially albumin. Low albumin is a big finding, might mean protein loss from the gut.
Like with severe IBD or cancer.
Yes, or certain conditions like lymphangiocytasia, or maybe the liver isn't making enough calcium levels too.
And your analysis adds more pieces.
Definitely. Checks kidney concentrating ability, crucial for assessing kidney function. Looks for glucose or ketones for diabetes. Protein or signs of inflammation in the urine point towards kidney issues. Yeah. Certain urine findings can support other suspicions based on the blood work.
Don't forget the poop test.
Never forget the fecal. Absolutely essential for ruling out parasites. Often need multiple samples because parasites aren't shed constantly. Standard flotation, maybe cytology, maybe special PCR tests for things like Giardia or Trichomonas in cats.
Okay, so you run this initial batch. If the answer isn't clear, or if these tests point towards something specific needing a closer look, then you go to more advanced diagnostics.
Exactly. The next steps are guided by those initial findings. Imaging is usually high on the list, abdominal x-rays or radiographs. They're good for seeing things that show up well, like dense foreign objects, bones, or really obvious gas patterns of obstruction. Less useful for soft tissue detail or wall thickness.
Which is where ultrasound comes in. The sources really highlight its value.
Oh, ultrasound is fantastic for chronic vomiting workups. It gives such detailed views of the soft tissues. You can measure the thickness of the stomach and intestinal walls, a key sign for IBD, lymphoma, other infiltrative diseases. You can look inside organs, liver, pancreas, kidneys, adrenals, lymph nodes, check for inflammation, masses, structural changes.
Wow.
Can often spot partial obstructions, fluid. And a huge benefit is you can often guide a needle to take samples, aspirates, or biopsies from abnormal areas, often avoiding major surgery for diagnosis.
What about CT or MRI?
Used in more specific cases, yeah. If you need even finer detail of a particular organ or complex area.
And sometimes more specific blood tests are needed after the initial panel.
For sure. If you suspect pancreatitis based on signs or ultrasound, you run the specific CPLI or FPLI. Older cats definitely need a thyroid level, T4, checked. If Addison's is on the list, you run the ACTH stim test. Testing vitamin levels like cobalamin, B12, and folate gives information about small intestinal health absorption bacterial populations. Low B12 is common with significant intestinal disease.
And that dietary trial fits in here too if you suspect food.
Absolutely. If the initial tests rule out major systemic diseases and the signs point to the gut, a strict NAVLE or hydrolyzed diet trial is often the next logical step. It's both diagnostic and potentially therapeutic.
Okay. What if you're still searching, or if the signs are really severe major weight loss, blood in the vomit, abnormal ultrasound suggesting infiltration? Then maybe endoscopy.
Endoscopy becomes a really valuable tool then. You pass a scope with a camera into the stomach and upper intestine. You can see the lining, directly look for inflammation, ulcers, masses, and critically, you can take small biopsy samples from that lining.
Which is often needed for IBD or lymphoma diagnosis.
Often essential for a definitive diagnosis of those conditions. You can sometimes grab small foreign objects too. The main limitations are you only get superficial biopsies, and you can't reach the entire intestine, especially in bigger dogs.
So if endoscopy isn't enough, or maybe the problem seems deeper or further down, that's when full surgery might be needed.
Exploratory laparotomy, yeah. Sometimes it's necessary. If endoscopy didn't give answers or isn't available, or you suspect something in the deeper layers of the bowel wall or in the pancreas or liver that needs a bigger sample, surgery lets you directly visualize everything in the abdomen and take full thickness biopsies of the gut or good samples of liver, nodes, whatever looks abnormal. And of course, it can be treatment too, removing a tumor or obstruction.
Phew. Okay. That whole process really drives home why this isn't simple and why vets need to follow that systematic path.
It's the only way to reliably get to the bottom of it.
So let's say you've done the detective work, you finally have a diagnosis. Treatment. Obviously, it's going to depend entirely on what you found.
100%. No magic bullet. It's completely tailored. But often some supportive care is started early, even during the diagnostic phase, just to help the pet feel better.
Like fluids, keeping them hydrated.
Absolutely critical. Correcting dehydration, fixing electrolyte imbalances with IV or subcutaneous fluids.
Yeah.
Often need to add potassium. It makes a huge difference in how they feel and cope.
And meds to actually stop the vomiting? Antiemetics?
Yes, used to control the vomiting and nausea while you're figuring out or treating the cause. Meropitant, Cerenia is very common go-to, works really well. Ondansetron, Zofran is another good one, especially for severe nausea. Sometimes drugs that help stomach emptying, like metoclopramide, are used, but cautiously. Not if you suspect a blockage. Mirtazapine is great for cats, helps nausea and appetite.
But there's a caution there, right, about just masking the problem.
Very important point.
Yeah.
Antiemetics provide relief, which is great, but they don't fix the underlying cause. They can make it harder to figure out what's wrong if used without a diagnostic plan. So use them wisely alongside the investigation.
What about suspected ulcers or stomach irritation?
Then you'd use gastric protectants, things like proton pump inhibitors, omeprazole, to drastically reduce acid, or H2 blockers like famotidine, less potent but still helpful. Sucralfate can be used to coat and protect ulcerated areas.
Pain relief if needed.
Definitely. If there's pain involved, which is common with things like pancreatitis or severe inflammation, appropriate pain meds are essential for their comfort and recovery.
And nutrition. That seems key.
Fundamental. Often start with something bland, easy to digest, low fat. If a food reaction was diagnosed, that special diet becomes the lifelong treatment. And if a pet is really sick, not eating, losing weight fast, sometimes a temporary feeding tube is necessary to provide that crucial nutritional support while they heal.
Okay, so that's supportive care. What about some examples of the specific treatments based on the actual diagnosis?
All right, so say it's IBD. Treatment usually involves that specific hypoallergenic diet, often long-term. Plus, immunosuppressive drugs, corticosteroids like prednisone, are usually the first step to reduce the gut inflammation.
Okay.
For tougher cases, or to lower the steroid dose, other drugs like chlorambucil or cyclosporine might be added. B12 shots, if they're deficient, maybe probiotics, requires careful monitoring because these drugs have side effects.
And if it was that adverse food reaction?
Simple, but requires discipline. Strict adherence to the safe diet. For life.
Chronic pancreatitis.
Low-fat diet is key, especially for dogs. Pain management. Antiemetics as needed. Fluids during flare-ups. B12 if needed. It's often about long-term management.
Cancer.
Highly dependent on the type and stage. Could be surgery if it's a single removable tumor, chemotherapy for cancers like lymphoma that are more widespread, or palliative care, focusing on comfort and quality of life if a cure isn't possible.
Kidney disease. CKD.
Management involves a special kidney diet, maybe fluids at home, drugs to control nausea and stomach acid, phosphate binders, potassium supplements, managing all the consequences of poor kidney function.
Hyperthyroid cats.
Several options: lifelong medication like methimazole, radioactive iodine therapy, which can be curative, sometimes surgery, or a special iodine-restricted diet.
Addison's disease.
That requires lifelong hormone replacement therapy, giving back the mineral corticoids and glucocorticoids the adrenals aren't making.
Obstruction.
Got to remove it.
Oh.
Surgery or endoscopy.
Parasites.
Specific dewormer for the specific parasite found. Fenbendazole, parental, whatever's appropriate. If there's chronic bleeding causing anemia, might need iron supplements too.
It's really striking how different the treatments are. You absolutely need that diagnosis first.
You really do. Throwing treatments at it without knowing the cause is often ineffective and can even be harmful.
And once you start treatment, close monitoring is key, right?
Essential. Regular rechecks. Tracking weight, appetite, vomiting frequency, energy level that tells you how things are going. Follow-up blood tests, maybe repeat ultrasounds or specific tests like thyroid levels or CPLI to monitor the disease and the response to treatment and check for side effects.
What about the prognosis, the outlook?
Just varies so widely. Depends entirely on the diagnosis. Excellent for something like a food allergy you identify and manage with diet. Much more guarded for advanced kidney failure or an aggressive cancer. For many chronic conditions like IBD or chronic pancreatitis, the goal is often good long-term management and maintaining quality of life rather than a complete cure.
So we've really gone from what seems like a simple issue, pet throwing up, to this incredibly complex journey through body systems, diagnostics, tailored treatments.
Yeah, it really highlights how interconnected everything is.
Yeah.
A sign in the gut can reflect something happening almost anywhere else. It definitely shows why, if your pet has persistent vomiting, getting a vet involved and following through with diagnostics is so important.
Absolutely. So here's something maybe to leave our listeners thinking about. Given this huge range of possible causes for chronic vomiting diet, gut inflammation, kidneys, liver, hormones, pancreas, cancer, you name it, what does this incredible interconnectedness really tell us about how important it is to pay attention to any persistent change in our pets, even if it seems kind of minor at first?
That's a really good question to ponder. Those subtle chronic signs can sometimes be the first clue to something significant.
Thanks for joining us for this deep dive.